I'm joined now by Dr. Maggie Powers, President of Healthcare and Education at the American Diabetes Association. Thank you so much for being here. There is so much going on at this meeting. I wonder if you can narrow down some of the really critical initiatives.
Well, that's really hard. There really is so much, and I'm a dietitian, diabetes educator, and I'm interested in the whole gamut of diabetes care. I typically focus on the nutrition aspects and the education, behavioral health aspects, as well as health systems. What I'm particularly involved in is I'm doing a presentation focusing on access to diabetes education.
One of the things I know that is critical is the diabetes self-management, and that can be so challenging for patients, and really something critical to be communicated to them so that they understand it.
Absolutely. It's not easy living with diabetes. Every day, all day long, you're making decisions that impact your blood sugar. And there's a lot to know, a lot to do, a lot to think about, and it can be very stressful. So we have diabetes education programs that are set up to address all of these concerns, from the knowledge to the application. And so we would like more people to come to diabetes education. The utilization rate is very low, and in fact I'm going to be talking about the benefits and how to reduce the barriers to access to self-management education.
What do you think some of those barriers are?
Well, one of the barriers, I think, is that the value of diabetes education is not well understood. So I actually go through step by step and outline the benefits about reducing A1C, low cost, actually can save cost by reducing hospitalizations and complications. There's no side effects to education, and there's a lot of psychosocial behavioral benefits. And so we're trying to be louder and clearer about these benefits. So I'm positioning it in a certain way that I think the message will resonate with more people. So just understanding the benefits is one of the barriers.
The numbers are low. Is there any key way to improve access?
Well, we're working on it. One, I said I was interested in health systems. I believe that health systems should include an automatic referral to diabetes education, or at least let the person know that there is diabetes education. And there's we talk about 4 critical times to assess, adjust, and provide education. And so just last year, a position paper on the topic was published jointly by 3 national diabetes and nutrition organizations. And what we did is we clarified when somebody should receive education and what is covered. So a lot of times people don't realize this is what is needed to self-manage your diabetes. It's not just try to eat more healthfully. It's what food do I purchase? How do I cook it? What do I feed the rest of my family? How much should I have? And what's its impact on my blood sugar? So it's putting it all together, from how you shop to how it's affecting your blood sugar. So education addresses all of that.
And I know nutrition is so important to you, but a lot of times there are some social factors that hamper that for patients. How do you get past that barrier?
So we don't do just tear off diet sheets. Everybody, and we try to avoid the word diet because that has a negative connotations, but we talk about a food plan and eating plan. So we typically ask somebody how they like to eat, what's their usual eating, and then talk to them about what the goals would be for their particular diabetes and where they are in their diabetes. Because type 2 diabetes can progress depending on how intensive their management is. So we factor that all in, and then we set up a food plan for them. And then we talk about how are you going to do that at work when the donuts are available? How are you going to do that when people want to go for a drink after work? Or your grandkids are coming over and they want to make cookies with you. So that's all part of diabetes education, nutrition therapy. We can help somebody process that, reduce the stress.
Small changes can make a big difference. Thank you so much.
Yes.